we are the lead partner organizations for two coalitions here in Pennsylvania, the Pennsylvania Health Access Network and Healthcare for America Now. We represent over 60 organizations statewide and over 1 million healthcare activists across the country. And we are here today at a critical time in the healthcare reform debate to really call on our legislators to enact healthcare reform quickly and pass legislation that will give quality, affordable healthcare to all Americans with a strong public option plan. So we're really at the verge of a healthcare crisis. Here in Pennsylvania, 2 Pennsylvanians die every day that could otherwise be prevented if they had access to healthcare. So Families USA is releasing a report today that shows that here in Pennsylvania, if we don't act healthcare reform legislation before 2010, 1,140 Pennsylvanians will lose their health insurance every week. Nationwide, over 6 million people would lose their health insurance by 2010 if we don't do something to really address the healthcare crisis.
I am a family physician. I am a member of the National Physicians Alliance, and I'm here to speak on behalf of the National Physicians Alliance because the American Medical Association does not speak for us. I'm here to support a guaranteed high-quality healthcare system for all of my patients, for all of you, for all of us. I wanted to share a story about a patient of mine. I saw him in the office about a year ago, midsummer. He was mid-20s. I'm going to call him John to protect his confidentiality. He was in his mid-20s, like I said. He was an assistant manager at a restaurant, and he was out playing basketball, a beautiful day like today, hurt his foot, and he went to the ER. Because as we all know, we already have universal health care here, right? We can all go to the ER, right? Sort of? Well, he was uninsured, so of course he probably got a bill a little bit after that. And he had a broken foot. And that particular fracture requires surgery within the next few days. Because it wasn't an emergency surgery, the ER sent him home, said, you can't see an orthopedic surgeon here, they don't take the uninsured. So, they gave him forms to fill out, a temporary disability, and 1 month later, he showed up in my office when his disability finally went through and told me the story. He's still in crutches, still with the same splint that they gave him in the ER. Well, I sent him to a surgeon who saw him and said, yes, this fracture needed to be fixed 1 month ago, and at this point, it's too late. So they followed him, and 3 months later, he was still in crutches, and still in pain, and still not working, and he could have been back. So these tragedies that I witness every day, and that a lot of you guys are here to share these similar stories, we've had enough of them in our field, and I'm sure you guys feel the same way. Our patients deserve better. So that's why the National Physicians Alliance supports Obama's plan to have a public health care option, or a public health insurance option that guarantees high-quality, affordable health care to all. Millions of Americans will have the peace of mind that we all desire.